The general procedure for range of motion measurement consists of the following steps. The first thing you're going to do is to put your patient in the appropriate position for the motion you're measuring. Right now, for the demonstration, I'll measure elbow flexion, elbow extension to flexion range of motion. So I have my patient seated on the mat, close to the edge, with the arm hanging over the side so that he can extend the elbow fully to achieve the starting position. You're going to uncover the joint to be tested, so we have the shirt off. Elbow is uncovered. Also important with this one to have the shoulder uncovered if you can, so that you can palpate and see the head of the humerus, since that's one of our bony landmarks for this measurement. Then you're going to simply explain and demonstrate to your patient. What I would like you to do is start with your exactly palm forward, and then just bend your elbow all the way up and all the way down. So I'm demonstrating the motion to my patient, and then I'm having my patient just actively move through it for my screening range of motion. In the clinic, if the screening range of motion is normal, you probably won't have to go any further, but for our purposes here, as we're learning how to measure range of motion and testing it, we're going to move through all the steps. So to actually measure the range of motion, you have to establish and palpate 3 bony landmarks. You need a bony landmark for the axis of your goniometer, a bony landmark for your stationary arm, and a bony landmark for the moving arm. In the case of elbow extension to flexion, the bony landmark for the axis of the goniometer is the lateral epicondyle. Sometimes it's a little easier to palpate with the arm and a little bit of flexion. So I'll do that. That's right there. And I will place my goniometer over that. The bony landmark for my stationary arm is the head of the humerus, which is right here. So I'm going to line that up there. And then the bony landmark for my moving arm is the radial styloid. So I'm going to line that up there. Now, can I have you straighten your arm out as straight as you can get it? There you go. Oftentimes people won't be at full extension in a resting position, so you have to cue them to achieve that. And now what I would like you to do is bring your elbow up into full flexion, all the way up that way. Excellent. When you do have the move into the ending position, you have to repalpate each and every one of your 3 bony landmarks, because sometimes they shift. And is that as far as you can bring it up? There we go. That's a little bit better. And then you can measure your ending position. So just to review, you always have to have 3 bony landmarks that you palpate, and you palpate them both for your starting position and for your ending position. When you measure passive range of motion, so that was active range of motion. When you measure passive range of motion, you are going to be doing all of the moving of the patient's arm. So let's say you pulled this test for your lab exam. In order to do the passive range of motion, you need to measure passive range of motion at both ends, since you do take a measurement and there's an end to the movement on both ends of this measurement for elbow. So first you're going to passively bring them into elbow extension as much as you can get. And then you will bring them into elbow flexion, supporting the extremity all the way up, repalpating to make sure that you still have all your bony landmarks lined up, and then give overpressure on that end as well to achieve full passive range of motion of that end of the measurement. So you want to make sure when you're doing passive range of motion, again, just to review, that you passively get the starting position to its full range, support the extremity all the way through, and give overpressure so you get your full passive range of motion at the end of the range as well. After you've done your active range of motion and your passive range of motion, you're going to assess the end feel. And again, since with the elbow you have an end to both ends of the range of motion, you're going to assess 2 end feels for this. You'll assess the end feel for elbow extension, and you'll assess the end feel for elbow flexion. Once you're done, you're going to record your results from your measurement. In this case, your results will be the starting position that you measured with a slash, and then the ending position that you measured. Just to contrast quickly, for example, if you were going to measure shoulder flexion, and I'm not going to pull up the goniometer to do that, but if you were to measure shoulder flexion, when you're doing your passive range of motion, this is the starting position for shoulder flexion. There is no end to this motion. The end to the motion is actually all the way back into shoulder extension, which is a separate measurement. So if they can get to the 0, that's your starting position, but you don't really do an end feel there because there is no end feel. And as far as passive range of motion, you just make sure they can get to 0 and then you're good. For your ending position, you will bring them up passively all the way and measure an end feel there as well.